According to Medicare satisfaction studies from places like AHIP, AARP, and Kiplinger's Senior Report, Medicare supplement plans consistently report satisfaction rates from 93 to 94% by members enrolled on their plans. So why are Medicare supplement members consistently happier with their plan compared to those on Medicare Advantage? Hi, my name is Mark Pripp. I've been helping people understand these two avenues of Medicare for over 15 years. And today I'm going to jump right in and show you from a statistical standpoint why people are so happy with their Medicare supplement coverage. So take a look at this. This is what's going to be covered in the video. So in this video, we're going to talk about the 94% satisfaction rate, Medicare Advantage network restrictions, prior authorization delays and appeals, why most denied approvals get overturned, delayed MRIs, surgeries, and cancer treatment, Medicare Advantage plan terminations, companies like United Healthcare, Humana, UCare, and Blue Cross Blue Shield exiting or terminating plans, the guaranteed renewability factor with Medigap coverage, out-of-pocket exposure differences, nationwide provider freedom when it comes to Medigap, why Medicare Advantage satisfaction drops once serious illness occurs. And then last on the list, we're going to look at, from a cost standpoint, Plan N, high deductible G, as alternatives if you find the standard Plan G to be too expensive. And then I'll close with my final thoughts. So let's start off at the very beginning here. As I mentioned, 94% of Medigap members are satisfied. 67% are very satisfied. And now why is that? The biggest reason I see is nationwide access to medical providers. They're more predictable. Once you pay your premium and understand your Medicare supplement benefits, from that point forward, it's very easy to understand how it works because you're not dealing with copays, network restraints, percentages, or copays that are tied to Medicare Advantage. You have fewer insurance barriers when it comes to the metrics or the formula in the way that the plan is designed compared to Medicare Advantage. Also, the long-term stability. There's a saying in the Medicare supplement world, and that is basically, as long as you pay your premium, you have your plan for life. And that report is from AHIP, which does national studies year-round. They do national studies on an annual basis, as well as the Kiplinger report, and AARP is constantly doing reports as well. Everything that I discuss here from a data standpoint, I'm going to link in the description the actual URL to these reports so you could study them on your own if you are bored and want to verify that I'm providing you with accurate information. So let's continue on here to our next slide here. At Medicare Advantage plans include only about half of local doctors. Okay, this is a very staggering number when you look at it. Medicare Advantage networks average only 46 to 54% of local physicians, whereas Medigap works with virtually any provider accepting Medicare nationwide. So your key points here, when you're laying the two side by side, is that Medigap, there are no network restrictions, there is no loss of a specialist or a network change, and you're not restrained with county limitations or any annual provider surprises. An annual provider surprise would be something like this. The way that a Medicare Advantage plan is going to try to manage cost is look at providers in the area that are underperforming that they can just do away with. They will always prefer providers that are the most efficient and cost the least for their members. So it's very common to receive a letter in the mail that the doctor you have now or that you once loved may not be on the plan in the following year or the coming months, depending on how they have made the changes. And the county limitation element is Medicare Advantage plans are offered on a county by county basis. So it's very common for a Medicare Advantage plan to say have a plan in all of, let's say, Florida, but they are going to say Hillsborough or Palm Beach County is underperforming. We're losing money there. We're going to remove and no longer offer that particular PPO plan. And what's very common, what you'll find in the Medicare Advantage space, is the plans with the most freedom and flexibility, like the PPOs, are the ones that are taking the hit the hardest, meaning they are being stripped back, and some companies are removing them from counties or adding a premium to them to offset the loss in cost. So from a network standpoint, roughly 50% of your local providers will take a Medicare Advantage, where up to 96% of providers are a part of the original Medicare A and B network, which works with your Medicare Supplement plan. So any doctor that takes original Medicare means that your supplement plan will be taken there as well. So that is probably the number one reason why people are so satisfied with their Medicare supplement, because they have established doctors. They don't want to change. Imagine you're mid-treatment with a specialist, and you are told that your specialist will no longer be a part of your Medicare Advantage plan. That can be devastating news when you're undergoing, something very, chronic or life-threatening, that you now, in the midst of that, have to pick another doctor. So based on my experience and everything I've seen, I believe the network and the doctor relationship with the patient is the most valuable thing that the consumer looks at. Next on the list is number 3. We're talking about prior authorization issues. Most Medicare Advantage denials get overturned. Medicare Advantage plans deny, even if you appeal it, they deny roughly 13% of prior authorizations. 82% of appeal denials are later overturned. Okay, so this is a report from the Health and Human Services. Again, I'll link that in the description below. Our key points are delays, paperwork, appeals, treatment interruptions, and stress during illness. So let's just back up for just a second here. Most people will say, well, gosh, 13%, that's not very much. If you read between the line, though, it says 82% of appeals are overturned. So that means that there's a high percentage of these prior authorizations that are initially being denied. You have to fight to appeal it through the appeal process. Once it goes to the appeal process, there's a high likelihood of it being overturned, but the fact that you actually have to do the legwork and do the work to try to get that claim appealed and overturned is absurd. That is something that you, again, like the provider changes, how could anyone be satisfied with a plan that they have to be involved with appealing the claim that often? Now, again, if you're diligent and go through the appeal process, it will most likely be overturned, but that's a lot of people that have to go through that barrier. It's almost like going to the DMV to renew your license plate tag instead of just, having it on auto renew. It's just a headache in the process of medical care that you don't want to deal with. And that the provider issue and the prior authorizations is one of the reasons why Medicare Advantage satisfaction starts to drop a lot when you use the plan a lot. Those that are on Medicare Advantage that don't use it often, well, of course they're happy. They don't use it. It doesn't cost them very much. But I'll get into that a little later, what happens when utilization actually takes place and you start to use this free plan that seems so amazing. The real colors shine when you go to use it. So let's continue on here. Moving on to Slide number 4, 22% reported delayed care. 22% of Medicare Advantage members reported delays from prior authorizations. Traditional Medicare members reported fewer delays. This is from the Kaiser Family Foundation. The most common delays come in MRIs, surgeries, rehab, skilled nursing, and cancer treatment. So not all things are going to require a prior authorization, but they know exactly where those are going to fall. And so your typical in and out office visit is going to be a pretty clean process. But once you start getting into more comprehensive care, that's when the train really starts to slow down and the frustration may start to build. Moving on to number 6 on the list, this is one that has really taken the industry by storm in the last year or two. Medicare Advantage plan terminations. Over 1 million people were forced to change plans during the 2024 and 2025 annual election period. This is just a quick set of data that I pulled. I'm sure there's more than this, but we saw United Healthcare terminated plans that affected 600,000 people. They actually terminated individual plans altogether. Humana was in the 500,000 to 600,000 plan terminations. UCare in the state of Minnesota terminated their Medicare Advantage program altogether. They had 158,000 members that they just closed the doors on, and all of those people were forced back to the marketplace. Blue Cross Blue Shield of Kansas did the same thing. They terminated their Medicare Advantage program altogether. Approximately 32,000 people were forced to find other coverage. Premera Blue Cross in Washington State did the exact same thing. This information is not hard to find online, but this is from the CMS Landscapes report, carrier filings, investor reports. It's all over the place. So people can lose MA plans for no fault of their own, particularly when carriers are not profitable and they leave markets, counties are dropped, or plans become unprofitable for the company. So this was not a common thing in past years. Typically what happened is we would anticipate, okay, it's the new annual election period, what's happening with Medicare Advantage. Medicare Advantage is built on a reimbursement rate from the federal government. So CMS, or the Centers for Medicare and Medicaid Services, they basically have contracts with all of the insurance companies and say, you build the plans and we'll reimburse you for each individual member as they are enrolled in your plan. So these Medicare Advantage companies, they do spend a tremendous amount of time and resources building these plans. But what happens is they build a plan with co-pays and a network and, a drug pharmacy list and, pick the doctors and hospitals and co-pays, and they build it to be competitive. Well, the plans will come with low co-pays or no monthly premium. So the reimbursement rate from CMS changes every calendar year. So every January 1st, that reimbursement percentage is different. Okay, so CMS looks at how much the company spent, how much they gave them, and then going into the new year, they say, well, based on all the analytical data, we think we're going to raise your reimbursement rate, 2% next year. Well, then the lobbyists go to Washington and they fight over it for a long time. And CMS usually comes back and says, okay, we'll approve it for, 4% instead. That puts the company in a corner because the company has developed all the plans and is paying all the claims. They can't manipulate anything to offset the cost. Like a Medicare Supplement plan, if you want to keep that plan the way it is and the carriers are paying out higher amounts in claims and premium, then the premium just goes up. You keep your plan, everything stays the same, so they can manipulate the premium because it's not a government subsidized plan. The Medicare Supplement plan is not subsidized by the federal government like Medicare Advantage. So think about it this way. When a new president comes in, let's say it's a president who has a chip on his shoulder about the private insurance sector, and their Health and Human Services are kind of disgruntled about it, well, they can dictate that reimbursement rate. Some years it's really high, but in these years of massive termination, it was too low and these companies had to shed all of these members. While the Medicare Advantage benefit looks really good on a brochure, everything I've talked about in these slides and previously, all of those inner workings are happening behind the scenes on Medicare Advantage. There's many, many working parts for that company to remain profitable and competitive. That's the complete opposite with Medicare Supplement. Medicare Supplement benefits are fixed. The premium, as long as it's paid, you keep your plan. You have no network changes, no plan terminations, no annual benefit changes, no need to re-enroll or find another plan. As long as you pay that premium, you've got the plan for life. So let's continue on here. Medigap is guaranteed renewable. Medigap cannot be taken away from you. Guaranteed renewable by federal law, cannot be canceled due to health, no county exit, no provider removals, none. You keep it as long as you pay your premium. That is the beauty of a Medicare Supplement plan, driving that high customer satisfaction rate. And I know what you're thinking, Medicare Supplement rates are reaching a height that has been very challenging for people. But as we continue on towards the end, I'm going to give you some ideas of what to do when it comes to the increase on Medicare Supplement premium. So stay tuned for that. Moving on, we're talking about out-of-pocket exposure, okay? Medicare Advantage can expose members to thousands in costs. The average max out-of-pocket, this data says $5,000 to $5,500, but now that amount is well over $8,000. So that is where you see the biggest disparity between Medicare Advantage and a Medicare Supplement. Plan G covers nearly all Medicare approved costs after your Part B deductible. I'm just kind of honing in on Plan G. So that free Medicare Advantage plan or low premium, it is affordable per month, but it has a tremendous amount of cost sharing mechanisms. You'll pay copays. Most of your cancer treatment is 80-20. So if you do have cancer treatment, most plans used to have a copay. Now they go straight to 80-20, putting that cap of $8,000. So all of your medical bills, all of your claims, all of your copays, percentages, basically everything in one bucket, your financial exposure could be as low as $5,000, but as high as $8,000 or $9,000, depending on your plan. So no, you're not paying much per month, but you're going to pay at time of service. So Medicare Advantage is no cost per month on most plans or low cost, heavy sharing when claims and utilization comes in. Medicare Supplement is the reverse. You pay more per month and less to nothing at time of service. Do your due diligence if you're looking at a Medicare Advantage. What plan are you looking at? What is the out-of-pocket maximum? How does that compare to a standard Plan G annual premium, a standard Plan N annual premium, and then the high deductible Plan G annual premium? Look at the four of those side by side, because I promise you, the high deductible Plan G, in my opinion, is going to beat any Medicare Advantage plan hands down when you do the math long term when it comes to freedom and flexibility, no referrals, no prior authorizations, no networks, freedom to travel. Even though you have that high deductible, you still have a high out-of-pocket max with Medicare Advantage. People are afraid of the high deductible Plan G because they don't understand it. I put a link in the description below. I did a video on high deductible Plan G comparing the cost and the utilization at doctors. I used some examples, some premiums. So if you're interested in the rock bottom cheapest Medicare Supplement plan, take a look at the description below. I've also included in the description a video on the cheapest Plan G premiums for 2026 and the cheapest Plan N premiums for 2026. So take a look at those. That will be a wealth of information if you're out there trying to decide what plan to pick. So moving on to number 8, we basically touched on this. On Medicare Advantage, the benefits can change every year. They are run on a calendar year, so your copays, deductibles, drug formularies, and provider networks, prior authorization rules, those are all developed and designed where they can change every year. And believe me, they do. Unfortunately, health insurance doesn't get cheaper. It gets more expensive and harder to manage. On Medigap, as long as you pay your premium, none of that your copays won't change, your deductibles won't change, your provider networks, you have none, you have no prior authorizations. Now, if you do have high deductible G or N, there is potential for that deductible to increase with time and the copays on Plan N to increase. But when you're laying this side by side, those changes historically are minuscule compared to the changes on Medicare Advantage. Number 9, let's move on to Medigap predictability. Again, we've kind of talked about this. I won't stay here long. Plan G benefits stay the same. Benefits are federally standardized. This means that the Plan G benefits are the same no matter which company you select. You cannot find a company offering a better Plan G than the other. You might find a company that has, gym membership incentives or dental and vision discounts or household discounts on the premiums, but the raw Plan G benefits are standardized and the same amongst all companies. Moving down a little bit, again, no surprises, no copay surprises, no network changes, no referrals, no annual authorization changes because there are none. So let's jump ahead again. Number 10, nationwide freedom, take your coverage anywhere. Medigap works nationwide with Medicare providers, no referrals, no service area restrictions, ideal for snowbirds, RV travelers, retirees, relocating, or just you have a home in one state and you have a home in another state, or if you need specialty care outside of your state, if you want to go to, a Moffitt Cancer Center or a Shands Hospital, or Johns Hopkins, some of these bigger ones that are scattered about the country, you can do that with a Medicare Supplement plan. And that is probably the second reason why Medicare Supplement satisfaction scores so high. Moving on to number 11, we're talking about how the satisfaction rate changes or declines on Medicare Advantage. And I've kind of touched on reasons why, but the key points here are priorities changing during cancer, surgeries, chronic illness, or specialty treatments. This is where medical claims start to get very costly. And this is where prior authorizations are going to come in more frequently because they're trying to, again, a Medicare Advantage plan is managed care. Like an HMO is managed care where you have to select a primary care doctor. If you need to see a specialist, you have to get a referral. You have to stay within a tight HMO network. If you go out of the network, you don't have coverage unless it's emergency. When you get into higher utilization on Medicare Advantage, the satisfaction rate starts to come down because now you're using it more, you're experiencing it more. It's similar to when you buy a car. You buy this brand new car, it's beautiful, it looks amazing, but you never realize that, the seat didn't go back as far as you wanted it to, or the gas mileage is way worse than you thought. So initially it was exciting, but once you don't know how things are going to work until you actually test them and try them. And that's why I love the satisfaction rate on Medicare Supplement, because it just doesn't lie. With the way that they're built and the freedom and flexibility, it's no wonder the satisfaction rate is as high as 94%. Last on my list here, my last slide is discussing, yes, Medigap costs more. That's just the reality of things. But lower cost options do exist, and let's get into this here. So Plan N, we're looking at lower premiums that of Plan G. We have some smaller office visit copays and ER copays. High deductible Plan G is much lower in premiums. The thing I love about it is it keeps all Medigap freedoms with the nationwide access, no networks, guaranteed, renewable. Of course, I've listed the sources here, but right now while you're seeing these Medicare Advantage companies terminate plans, healthcare costs are going up everywhere. It's inevitable. It's not just Medicare. So Medicare supplement premiums have gone up as well, some as high as 25 to 30% on Plan G, slightly less on Plan N. Your original Medicare A and B is there working for you from day one. So most people don't realize, but as soon as they get on Medicare, they think, well, now I have to get a supplement or an Advantage plan because I don't want to be stuck with Medicare only. Well, here's the thing. Original Medicare is a phenomenal benefit in coverage. The way that it's structured, the way they pay, the way that there's network flexibility and freedom. The greatest risk to original Medicare only is there's no cap or out-of-pocket maximum to your original Medicare benefits. So all of your original Medicare, your 80-20 percentage coinsurance, your hospital deductible, some of the additional deductibles that come in for more comprehensive care, those, like the hospital deductible, can reset after 60 days. So all of your care in a bucket on Medicare A and B, there's no point that you stop sharing in the cost. Remember how we talked about Medicare Advantage at least has a cap of, let's say, worst case scenario, $8,000. So you'd rather have Medicare Advantage with that $8,000 financial cap to you than original Medicare A and B only, because there is no cap to that. Well, when you add high deductible Plan G, that is basically laying an out-of-pocket cap on your original Medicare. It is absolutely brilliant because, again, you could live with original Medicare only, but there's one element missing, just one, and that is the out-of-pocket maximum is not there. Well, when you lay the high deductible Plan G on that, you now have a very comprehensive, affordable, extremely affordable. I saw someone comment on my video last week on a different video that said they turned 65, they're in North Carolina, and they just took out a high deductible Plan G for $36 a month. That is incredible. So you mean to tell me if I get on original Medicare A and B, let's say you're in a really expensive state, and you have to pay $100 for high deductible Plan G. You mean to tell me that I just have to pay $100 a month and I have an out-of-pocket limit now of $2,900? So when you look at the cost, and that's in the video that I linked for the high deductible G, I did a comparison of what it costs you to go to the doctor, what it costs you to go to the hospital between G and high G. And then I gave you an example of what the premiums would be spread out over 5, 10, and even 20 years. So that's the kind of stuff you want to look at. I'm personally on a family plan, and my premium now is $1,400 a month, and I have a $5,000 deductible before they will pay anything. That is absurd. So if you're on original Medicare A and B and you had to pay $100 for the high G, again, all of the features of standard Plan G are the exact same with high deductible G. It's just that the supplement will not start helping you until you have paid that $2,900 out of your own pocket, and that is the most you would pay on the high deductible Plan G. So I hope this helps. I've covered a lot of information quickly. I am a big advocate of Medicare Supplement because of the freedom and flexibility and lack of headaches. So I can speak firsthand that I have seen how they work, how our clients have been so happy with them. The 94% satisfaction rate is very accurate. We've had mixed reports from our Medicare Advantage clients, and as of late, they've not been very good. So hopefully the Medicare Advantage plan market can start to self-correct and come back around and be a little more stable. If you have questions, comment below. If you want to do a needs analysis, we're licensed in 46 states. We would basically just gather your general information, tell you what plans are available in your area. We like to educate people, let them know what options they have, and then ultimately let you decide. So reach out if you have questions. We'd be happy to help. Take care.